Hello, everyone. My name is Michelle Wang. I just finished my second year at Northeastern as a biology major, and I'll be presenting the research I worked on during my first co-op at Massachusetts General Hospital through the CaNCURE program. I worked under Dr. Cesar Castro and Dr. Hyung-Soon Im at the Center for Systems Biology at MGH, studying resistance to PARP inhibitors in ovarian cancer patients. To begin, ovarian cancer is one of the most common gynecological cancers with a lifetime risk of 1 in 75. It continues to present itself as a global burden with a high mortality rate, but luckily there are many different types of treatment options available. One of the newer types of targeted therapies are called PARP inhibitors, which act against a protein involved in DNA damage repair to prevent cancer cells from repairing. However, unfortunately, not all people respond well or have the same effect to each drug, and many patients are reported to develop eventual resistance to PARP inhibitors. Thus, it's clinically impactful to understand the mechanisms involved in this resistance and strategize clinically viable treatment methods for one who has become resistant. One of the most common PARP inhibitors used is Olaparib. To study its resistance in vitro, we've taken these 3 ovarian cancer cell lines and administered a small amount of drug daily for several months just until they acquired resistance to it, just as patients do in the clinic. And this was confirmed by characterizing the cell's sensitivity to Olaparib, saying that the resistant cells required a higher dose to achieve the same efficiency. Now, to see if this acquired resistance can induce any cross-resistance to other commonly used treatments, we conducted MTT assays on both the parental and resistant subtypes for each treatment, which provided with IC50 values that tell us how sensitive these cells are to each drug. So far from the preliminary data, IC50 values between the parental and resistant cells have been relatively close, so it seems that for these drugs, resistance to Olaparib does not induce any cross-resistance. This can be impactful as it seems that these may be effective possible second-line treatment options for a patient who has acquired resistance to Olaparib. But if this is the case, then it should mean that the Olaparib-resistant subtypes are fully sensitive to these drugs. The first drug I was able to fully characterize was Rucaparib. So I performed a proof of concept experiment where I treated only the resistant cells, modeling the clinical treatment scheme. So after the 4 weeks of treatment, I was able to see a significant decrease in number of viable cells in the post-treatment cells. Also during the entire process, before, in the middle of, and after treatment, I also collected the medium from the cells to extract EVs. These are extracellular vesicles that are membrane particles secreted from the cells, which carry information from the parent cell, including proteins. The plan is to ultimately use the EVs to perform proteomic profiling and compare protein expression levels before and after treatment in order to better understand the mechanisms involved in the resistance pathway. Analyzing these EVs would also be beneficial in the process of diagnosis, as they would be prime targets for use in liquid biopsies. In terms of future directions and ongoing work, I'm currently conducting the rest of the treatment schemes for the other drugs, also collecting the EVs as I go. After each treatment, I will also reevaluate the sensitivity of the post-treatment cells to Olaparib to see if the treatment had any effect on the level of resistance. And finally, after all of this in vitro work, we hope to validate our results using a mouse model. And we've already found a collaborator at MGH to work with for that project. Overall, I believe this research has the potential to just be extremely impactful in finding ways to strategize treatment options for someone who has become resistant to Olaparib, especially because methods and strategies like PARP after PARP have not really been explored much yet. Finally, I just want to acknowledge the CaNCURE program. at Northeastern and this MCI grant, which made this project possible, as well as my mentors at MGH, Dr. Cesar Castro, Dr. Jungsun Im, and Dr. Ursula Winter, who has continuously supported me throughout my research here. Thank you.